Maxi Life Wellness Fridays featuring Seeing 2020 and 2021, digital eye strains and common questions asked in clinics. Again, I'm Patricia Bermudez. He's on your host for this event. In this digital era, most people have their eyes glued to the screens more than ever. But how do we maintain eye health? This session will get you across the signs and symptoms of digital eye strain, different refractive errors, and common questions asked by patients in the clinic, such as about progressive lenses, UV, blue light, and presbyopia. So it's time now to meet our speaker. Our speaker has extensive medical and surgical training in general ophthalmology and pediatric ophthalmology and adult strabismus in a tertiary government in the Philippines and in the United States. Now, he also has background in public health, and that's why we're very happy to have with us Dr. Norman Eric Fajardo. Hi, Dr. Fajardo.
Hello. Hi. Good afternoon. Thank you for having us here.
Oh, I'm looking forward to this. It looks like a lot of people here have been sharing their concerns with their vision. So I think your presentation will be really appreciated. Go ahead and share your screen, Doc Fajardo. There you go. Thanks
Okay.
so much. Looking forward to this, Doc.
Okay. Let me just do some adjustment. Okay. Are we all set? Yes. Hello. Good afternoon. I'm going to talk about digital eye strain and common questions asked in the clinic. So the objective of this talk is to be able to explain refractive errors as it relates to digital eye strain and to answer common eye questions asked in the clinic. So the outline of this talk, we will start with anatomy of the eyes, the different refractive errors, the digital eye strain, and finally the common questions asked in the clinic. So on our right on the screen is a picture of the eyeball, of an eyeball, and lower here is a schematic representation of this eyeball. The cornea, which is the front part of this eye, is actually the windshield of our eyes. It is the one affected in dry eyes. So pay attention to that because this is where the faint fibers are. So if we feel our eyes are dry, this is the one that is affected. The next structure, important structure, is the crystal lens, which is this part here. Okay. This is actually the autofocus of the eyes. So it changes refractive power whenever we look at different objects at different distance. It is really affected in a 38-year-old individual, so that in that case, we start having presbyopia already at that time. The third important structure here is the retina, which is the part here behind the eyeball, and this part here. It is actually the sensor of our eye, which is equivalent to the sensor of a camera. It absorbs the light and images, and it's brought to the brain. Okay, so what are the different refractive errors? When you say you're emmetrope, your example prescription is something like this: plano, which is 0, or a plus 0.25, or a minus 0.25. Your vision without glasses is actually clear at distance and at near. You say you're farsighted when your example prescription is something like this, plus 100 or plus 150. You usually have clear distance and near because of the autofocus function of the eyes. You say you're nearsighted if your prescription is minus 50 or minus 200, and you see blurry distance but clearly at near. You say you have astigmatism when your prescription, similar to this one, plus 0.25 and minus 150, axis 180. This is actually your astigmatic number. Or you may have a minus 100 and a minus 200 astigmatism, like this one here. Usually have mild blurry vision at distance and near. It is because the cornea is not round in shape but oblong. Your presbyopia is not actually a refractive error. It's because of the reading glasses, the one similar to what I have now, to be able to read this screen. It is a problem with the autofocus of the eye at near when you get to about 38 years old. So your refraction or your prescription might look like this, plus 150 with an add of 150. This is your presbyopic eye grade. Or you might have a minus 150 with an add of 150. So you usually have blurry at near, blurry vision at near because of weak focusing. So the following slides are schematic or illustrations of how we see. First, this slide tells us how we focus when we are without corrective glasses. So our object is about 20 feet. You have this type of prescription. So the object reaches the eye and it's focused on the retina when you are emmetrope. You are farsighted when the object is focused behind the eyeball. You are nearsighted when the object of regard at 20 feet is in front of the retina. So you need glasses, corrective glasses, to be able to see clearly. So this is what happens when you have glasses. For emmetrope, there's no problem. For farsighted, the image has to pass through the glasses so that the glasses will help you focus the image on the retina. Similar to nearsighted, the object has to pass through the glasses to focus the image on the retina for us to be able to see clearly. So what happens when we are reading or using computer? Our reading distance is actually 12 to 14 inches, while the computer distance is about 20 inches. We call this intermediate distance. Okay, so for an emmetrope, the lens becomes thicker. This is the autofocus function of our eye to bring the image on the retina. When you have glasses with you and you're farsighted, this is for the distance correction. The lens of the eye becomes thicker also, as well as the nearsighted individual will have a thicker lens to be able to bring the images focus on the retina. So this is very important when our eyes gets tired, because the autofocus mechanism of the eye gets tired eventually. So you will get a headache, your eyes will feel dry. So this is very important and in digital eye strain. So what happens if you're 38 years old and above? I've noticed earlier in the survey, in the questions, about 40% needs to use glasses when reading. So our audience is about 40 and above. So for an emmetrope, you need to wear reading glasses to help you focus at near. It has to pass through the reading part of the glasses. For a farsighted individual, you need to have this part here, which is the additional part of the glasses, to help you focus the near image at near, because you have weak focusing abilities already. So your prescription would look like this, similar to this. So what is digital eye strain? So digital eye strain, also known as computer vision syndrome, encompasses a range of ocular and visual symptoms, and estimates suggest its prevalence may be 50% or more among computer users. So in a study done in 2018, there was a comparative percentage of computer users compared to 2011 and 2017. This is a graph of the percentage of users on your left, then on the x-axis, the age group in years. Compared to 2011, there is a significant increase in computer use across all age groups. It's nice to note that the older ones are using computer more because they are adapting to technology. So in effect, in 2017, there are more computer users across all age groups compared to 2011. This is a table of reported symptoms of office workers in New York. It was done in 2012. The most common reported symptoms of these subjects are, number one, tired eyes in 39.8%. Number two, dry eyes in 31.5%. Eye strain in 30.6%. And eye discomfort in 30.8%. Pay attention to this symptom here. Blurred vision while viewing the computer. Blurred vision when looking into the distance. For example, you're using your computer, if somebody calls you, then you look straight out, Your vision still blurry. That's because your vision is still focusing at near. It has to relax. There's difficulty or slowness in refocusing my eyes from one distance to another, similar to the one above. So this is actually related to the tired autofocusing abilities of our eyes. Similarly, these two reported symptoms is related to dryness, as well as these two reported symptoms are related to tired focusing of the eyes. And lastly, dryness as well. So the culprit in digital eye strain is actually just dry eyes and tired autofocusing abilities of our eyes. So how do we treat it? So for dry eyes, we encourage patients or we encourage subjects to blink more often. As I mentioned earlier, our cornea is the windshield of your eyes. If you're driving and your windshield is dry and you activate the wiper, it will create a noise. But if you lubricate the windshield, it will be smoother. So you also want to lubricate often using artificial tears. And if you're working in an aircon room for a long period of time, it aggravates the dryness of your eyes. The next treatment is you want to rest your eyes regularly. Look at a distance when you are on a break so that your eyes or your autofocusing will relax. Or you can close your eyes but do not sleep. Okay? Or you can also use computer glasses. Your computer glasses are actually weak magnifying lenses, and the one to help you focus at near, and the one with an anti-glare because it helps you when your eyes are dry, you tend to have a glare. So what are the common questions that are asked in the clinic? So what are progressive addition lenses or PAL? It is commonly called progressives. It's a type of lens which help you focus at distance, this part here. The intermediate part, which is for computer distance, and the near part, which is for reading. So the problem with progressive addition lenses is that it's sensitive to frame displacement. So if your glasses goes down here, you're using a different area of the glasses already. So you will have discomfort or you will see blurry. So you pay attention to the position of the frame all the time. So do I need UV coating for my glasses? It's a long-standing knowledge that prolonged ultraviolet exposure is harmful. So yes, you need UV coating for the glasses so that you can protect your eyes from the UV rays. Do I need blue blocking lenses for computer use? So the pros for using blue blocking lenses are blue light in high amounts have been found to be harmful in the retina in experimental studies. So mind you, in that experiment, they use high amounts of blue light to induce injury. The cons for not using blue blocking lenses, the amount of blue light in digital devices was found to be very low. And there's no studies that have shown that blue light coming from computers is directly harmful to the eyes. So do I need blue blocking lenses? In a study conducted in 2020, there is little evidence at this time to support the use of blue blocking filters as a clinical treatment for digital eye strain. Management of other ocular factors, as well as the creation of an optimal environment for screen viewing, are more likely to provide greater success in minimizing symptoms. So a last question is, do supplements and magic eye drops cure refractive errors and cataracts? Because we see a lot of this in social media nowadays. Is there a potent capsule or supplement that will cure this refractive errors and magically cure your eye refractive error? Or is there a magic eye drop that will cure your cataract or you will cure your pterygium? Actually, there's no evidence that these supplements or magic eye drops will cure refractive errors and cataracts. Thank you. Patricia?
Yes, thank you so much, Doc Norman. Honestly, I see that a lot of individuals already have questions about what you've just shared. Of course, everyone is very concerned about their eyes, particularly this time. So we really appreciate your time, Doc Norman. And we will have Doc Norman back with us in just a short while because I know that you all want to still continue to learn about your eye health. But we are grateful for many of the common questions that Doc Norman had already put out there. But I'm sure you all have more. That's why we bring in another expert who will facilitate this Q&A. Our moderator graduated magna cum laude in Bachelor of Science in Psychology at the University of the Philippines, Diliman. She then took Doctor of Medicine at UP Manila, and she underwent ophthalmology residency training at the Department of Ophthalmology and Visual Sciences, UP Philippine General Hospital, and was chief resident. She topped the Philippine Board of Ophthalmology Diplomate Examination. She is presently a cornea and external disease consultant at the Asian Eye Institute, and she's an active member of the Philippine Cornea Society and the Asia Cornea Society. Let us all welcome Dr. Charlene Noguera. Hi, Doc Charlene.
Hello, good afternoon, everyone, to those listening to this webinar. Thank you very much, Ms. Patricia. So thank you very much, Dr. Norman Fajardo, for that very interesting and wonderful lecture. So the next part of this session is the Q&A. So for our first question for Dr. Norman, okay, so when is LASIK advisable? So I'm curious because I still see many eye doctors who still wears their glasses, wears their glasses, LOL. Okay, so I want to know if it's worth it with $3 sim.
So
So
it's a question about LASIK. Oh, okay. So the first criteria in having a LASIK, you must be at least 18 years old and above. That's number one. You must have stable eye grade. So your refraction should not be changing constantly. So you should be following up with your doctor regularly to find out if your eye refractive error is stable already. If it's stable, then you have to go through a screening procedure, which will do all these tests to find out if it's safe to do LASIK on you. So for me, if you're young, and the ideal age to have the laser is between 20 to 30 years old because your glass-free years will be longer. Because when you reach about 40, you will have to wear reading glasses. So for me, the ideal age, you can have LASIK actually anytime. But the ideal age to have it is between 20 to 30, wherein your eye refractive error is very stable and you're younger and your glass-free years are going to be longer.
yeah, so if you calculate also, sir, the Dr. Norman, the price of your glasses or your contact lens for a lifetime, maybe that's also equivalent for your LASIK. So
Yes.
so that's something to consider, no? So thank you, Doc. So the next question, Dr. Fajardo, is that I'm 53 and recently diagnosed with mature cataract on my right eye. The doctor recommended surgery to improve my vision. So if I have surgery, how soon can I go back to work right after? So I'm working from home and I use the computer for work 8 hours a day.
Actually, after surgery, a day or two, you can go back to office work. As long as your eyes will not be contaminated post-surgery. That is important there. But usually because of the technology that is available in dealing with cataracts, the recovery is very fast. So in a day or two, you can go back to office work.
Yeah. Yeah. So just as long as you don't wet your eye, so protect your eye, use the eye drops that your doctor will give you and use protective goggles. No? So there are lots of instructions you need to follow after your cataract surgery. Okay. So next question, Dr. Norman, is Doc, ask lang po if ano po kayang problem ng mata kapag
Sorry?
kapag gabi daw po is
Okay.
nag-drive or sakay siya sa passenger seat, and then during the headlights po, he sees it na parang star type daw po. Okay, so pero di daw siya gumagamit ng eyeglasses kasi sa Snellen chart malinaw naman daw po kahit maliliit. So baka po may mai-recommend po kayo.
Okay. So apparently there's glare pag pag merong headlight nakasalubong, no? So it can be anything. It can be as simple as dry eyes, simple as a mild corneal scar, or even a mild cataract, or there's something in your eyes that's making the light parang sumasabog yung light. Kaya nagkakaroon ng halo. So it's best to be checked to find out if you have any of these things. No, the simplest is artificial tears, dry eyes, but you need to be checked for other problems as well. So that is what is important. If you're nearsighted sana, or you iba kasi nagde-develop ng nearsightedness a little bit, sometimes a simple artificial tears and eyeglasses will help a lot.
Yeah. So I agree, Doc. It's very important to have your eyes checked po if you have these kinds of symptoms, just to rule out any serious eye condition. No? So next question, Doc, how often should I change my glasses? And how often, so very good question, how often should I go to an ophthalmologist? So her eye grade, Doc, po is 225 and 300.
I assume that's nearsighted siguro, no?
Yeah, maybe nearsighted po.
Usually in adults, we ask patients to come in every year, okay, to check for eye pressure. If you're nearsighted and you have significant nearsightedness, then we check also the retina to make sure that your retina is healthy. The eye pressure is checked for glaucoma. So if you have a family history of glaucoma, it's advisable to get it regularly. As far as changing the eyeglasses is concerned, I'm frugal. So if I don't see any significant changes in the glasses and it has not affected your vision, then you don't need to change the glasses. But if you have many scratches, your glasses are damaged already, then you need to change, even if there's a slight change in the refractive error. So in short, annual checkup and change of glasses depends.
So yeah, I agree, Doc. And then, so the next question was already answered by you. So any eye care tips, especially with people using eyeglasses? So that's very important to have your eyes checked at least yearly, or if you notice any symptoms or any unusual things for your eyes, especially like floaters, flashes of light, you need to have your eyes checked by an ophthalmologist.
Especially those patients with high nearsightedness or high myopia, because your retina is a little thinned out. So, mas madilis siyang mapunit. So, you can have a retinal rent that needs to be checked once in a while.
Yeah, so yes, Doc. So, the next question, Doc Norman, is do the blue light or UV filter that is in the glasses really work?
Okay, they really work in blocking UV and blue light. The question is actually, do you need it? Regarding UV, you really need it because prolonged exposure to the UV, ultraviolet rays of the sun outside, really can be harmful to the eyes. It's associated with cataract formation and other problems. That's why yung mga derma natin, they ask us to put sunblock when we're out in the beach to protect our skin so that our skin will not be as, not so much so anti-aging ng mga derma in short, no? As far as blue light is concerned, number one, blue light, there was as mentioned in the lecture, there was an experiment. They exposed it's an experimental animal naman ang ginamit nila to check if the blue light can damage the retina. So they exposed the eyeball in high concentration of blue light, no? So it was found to be harmful. Now, is it necessarily applicable to our devices? Our devices are outside. If you go out, we are also exposed to blue light because blue light is part of the sun rays. So the question is whether the digital devices will give us extra exposure to blue light. Will it be harmful? So there was a study and they measured blue light in these devices and it was found to be very small. Okay. So if you ask me, kailangan blue light? I think it's not that necessary. Okay? Will it prevent digital eye strain? Not then necessary. It's more of a habit. Will it be harmful if my glasses have it? Hindi naman. It's just extra expenses. So sinasabi ko sa patient ko, I'm the frugal type. If you have it, you can spend for it, then it's okay. But if you're on a budget, then you don't need it. Don't be pressured into getting it because it doesn't necessarily cause disease. Yun ang takot usually mga pasyente. Will it cause disease? Do I need it? Hindi naman. It's not been established yet as far as exposure to blue light in digital devices. There's also a study that says blue light may affect the internal body clock of our body, yung tinatawag na circadian rhythm, which affects the sleep. Meron daw. But the American Academy of Ophthalmology came out with a position or an article about this. Sabi na, it's not because of the blue light per se that is causing the problem in our sleep. It's the habit of tiring yourself to sleep. When we relax, when we get home and we relax, we play on our phone and use the Facebook, using our phone and tire ourselves to sleep. That's actually a bad habit as far as yung sleep discipline, because we induce ourselves to sleep by making our eyes tired. But in effect, we should be able to go to sleep at around 10 and tuloy-tuloy, magka-quiet down yung brain.
Especially when we will watch those series on Netflix. Like, so hindi na tayo makakatulog. We want more episodes. Yeah.
Okay.
So follow-up question with that, Doc Norman. So basically, it's not harmful naman if the glasses has no blue light na po, because the computer naman has insignificant amount of blue light. However, di ba nauuso ngayon, Doc, yung online schooling? So these kids, there are advertisements on our social media sites to buy this through online, those blue filter glasses. So is it advisable to buy this online blue filter glasses?
My position there, actually, the Philippine Society of Pediatric Ophthalmology also came out with that Facebook campaign about this thing. No, so as I mentioned earlier, the amount of blue light in our digital screen is not that much to establish injury in the eyes. Okay, so it's optional. So if you ask me, yung mga patients ko bang bata, pinalalagyan ko ng blue light, it's optional for me. It's not automatic. Ang minimum kong pinalalagay is the UV coating.
Okay.
To protect the eye from UV rays. My advice is for those students who yung homeschool,
online school, sir.
Online schooling, place the computer near the window so that when they want to take a break, they are given a break, that the patient or the child will look straight out the window to relax the eyes. And bawal ang YouTube. Kasi ang ginagawa nila, miski with my children, what they do when they take a break, nanonood ng YouTube eh. Kaya pag nahuhuli ko, you should be taking up, standing up and stretching your body, doing some stretching, and not, YouTube is not a break, eye break. You should stand up and exercise and look straight out to rest your eyes.
Yeah, that's true, sir. So for the next question, so I'm 52 years old and teaching.
Sorry, 50?
52, sir, and then teaching naman siya through online classes. So how much time is ideal to prevent digital eye strain?
Okay, I think it's not that time. You have to have short breaks in between. Kamukha nung sabi mo kanina, 20-minute rule, 20 minutes, every 20 minutes, 20 seconds, you blink your eyes, then look straight out. The only way to relax your autofocusing is either you look straight out or close your eyes para mag-relax yung autofocus mo. Then what you want to do is stand up. Do some stretching so that hindi ka mapapagod sa neck. Your back will be straight. Because if you're sitting for a long period of time, you can get back pain as well. Kasi nagko-compress yung intervertebral disc. So you have to do it regularly. 20 to 30 minutes break interval, and that will be fine. Do it regularly lang.
Yeah, so that's very important. So for the next question, Doc, I'm using Hyabak. So Hyabak is an artificial tears, no, 4 months now, and just started Lipolin last week. So maybe this patient has severe dry eye, Doc.
That's your alley. That's your alley, sir.
That's my specialization. Yeah. Doctor will see me back after 3 months. Okay, so if in case my case worsens, will there be alternatives? No? So what causes dry eyes apart from direct heat of electric fans, air conditioning, and smoke? So what other precautionary measures do I need to do? By the way, I haven't been using prescriptive glasses prior to the pandemic. Okay,
What I have observed is that patients who sleep late develop dry eyes. It's more of the evaporative type of dry eyes. Those who are busy, staying in air-conditioned room, they work until 12 o'clock, 1 a.m. in the morning. I see also this often in patients who work at the BPO, yung may shifting sila from 10 p.m. to 6 a.m. Ganun yung kanilang trabaho. So they develop dry eyes and chronic dry eyes. That is, no, it's being associated with the poor sleep-wake cycle. Other than that, exposure, allergies, smoke. I've also noticed that patients instill the artificial tears irregularly. Only when they feel something, they put it in. My advice to patients is to put it regularly. Even if you don't feel anything, you instill it every 3 or 4 hours regularly, even if you don't feel anything, so that it will prevent the symptom of dry eyes, and it will allow the eyes to recover, because nadadamage yung eyes mo when your eyes are dry. When your cornea feels something, then nadadamage siya. It's an indication there's mild damage on the cornea. So you want to lubricate it regularly para if you don't feel anything, that means your eyes will recover and it's not getting damaged. Yeah. Maybe you could share something, Shar.
Yeah. So for the question, no, so the artificial tears that she uses po is a preservative-free artificial tears. So it's very good. No, it's like organic, so it's good because you can use it anytime. So I advise my patients to, depending on the severity of your dry eye, sometimes 3 times a day or more for severe patients with dry eye patients with severe dry eye. No, so sometimes I ask them to put every hour. That's why it's very important not to use those over-the-counter artificial tears. So make sure po na you get your prescription from your ophthalmologist, because we know what medications or artificial tears we will give. No, so for any alternatives of course, treatment for dry eye is step ladder. So if the artificial tears, lubricant, and gels do not work, there's still alternatives. You can ask your doctor and have her check.
Char, I think the fact na naka-lipoline na siya, it's a viscous artificial tear. Medyo yung symptoms siya nag-aggravate.
So gumagamit na po siya ng gel, ano. So basically before the digital age, no, ang nagkaka-dry eye lang po usually is postmenopausal women. So yan talaga ang age ng dry eye before. Females 50 years old and above. However, di ba doc, we see even kids, no, we see kids with dry eyes na rin because of overuse talaga of the digital devices, online schooling. So those are really the causes of dry eyes, no? So precautionary measures, as mentioned na po by Dr. Fajardo, no? So 2020 rule, don't forget it, no? And then make sure to rest in between. So in between your computer use, no? So next question, Doc, is my mother is 69 years old and has a cataract. Is there any medicine she needs to take to cure this? So can cataract be cured, Doc?
The cataract, the only way to take out the cataract is through surgery. There's no eye drop that will reverse the cataract. Okay? If there's such a thing, automatic yun ang gagamitin ng doktor. So sinasabi ko nga sa mga pasyente ko if there's such an effective eye drop that will reverse cataract, then yung naka-imbento nun, ipa-assassinate ng mga nagbebenta ng mga IOLs at ng mga equipments for cataract surgery because mawawalan totally sila ng negosyo. So in short, the only way to take out the cataract is through surgery, and there's no eye drop that will reverse it.
Yeah, so there's no magic eye drops to cure your cataract or remove the cataract by just using eye drops. So if you have, usually the symptoms are cloudy vision. So if you experience these symptoms, visit us, your ophthalmologist, so we can check. So not all cataracts naman, di ba, Doc, is for surgery agad.
Yes,
so you still correct, your vision with glasses, of course, we will still recommend you to use glasses and not surgery right away. So that's why it's very important to have your eyes checked. No? So,
in addition, Char, for cataract surgeries, no, I've seen some patients na nag-mature tumigas yung cataract. What I tell my patients, if the cataract is causing visual problems already, then it will be better to remove it earlier. Because it's easier to operate on a 70 or 65-year-old person than an 80 or 85-year-old na mas matigas yung cataract because the eyes are weaker. The cornea is weaker at a later age. Yeah. So don't hesitate to have that surgery if the cataract is already affecting your function or your vision.
Yeah, that's right. So we don't do naman po surgery left and right. So we all have these guidelines that we follow when we recommend cataract surgery. Okay, so next question. Hi, Doc Norman. My concern, bakit po kaya sumasakit ang mata ko? I am a diabetic patient. So na minsan, masakit din po ang ulo ko.
Okay. Yung sakit ng mata can be dry eyes, kagaya ng sinabi ko, no? Sakit ng ulo, it's because can be anything. It can be a sign. Sabi ko nga, usually napapagbintangan ng mata pag may headache na kung nakikita. It turns out may sinus pala or may other problems or tension headache. So that will depend on the cause, no, ng headache. It's not necessarily the eyes. It can be allergies, can be tension headache, can be a lot of things, no? Actually, ang importante dito, if you're don't sleep late, instill artificial tears. If it persists, then see a doctor to find out if there are other things involved, no?
Yeah, so that's right. So another question, Dr. Norman, is what food or vitamin supplements can we consume in order to prolong our optimal eye health? Does this include those food supplements that contain lutein?
Okay. Doon lutein will support the metabolic demand of the eyes. Yung tinatawag, yung earlier when I showed the anatomy of the eye, there's the retina, the back part of the eye, which absorbs all the light that goes in the eye and converts that light into image. Doon papasok yung mga lutein. Doon sa metabolic demand, metabolic activity ng eyeball. But it doesn't mean it will make your grado go away. So that's the common, syempre, pag nagma-market, minsan, you tend to associate clear vision, meaning nawawala yung glasses pag uminom ka nito. Actually, doon papasok yung mga vitamins, doon sa conversion ng light into an electrical energy at the retinal level, which is very metabolic. Like taking vitamins and having lots of energy. It's the metabolism of your body that's where the vitamins work. Okay?
Yeah.
But it doesn't make the grado go away or your presbyopia cured, no? So it supports the metabolic activity of the body. So any vitamins will be fine, multivitamins will be fine. As long as you eat properly, you don't eat too much junk food or you don't consume too much alcohol. Alcohol is okay, konti lang. Proper diet will help a lot, no? Fats is not bad. A little fat will be fine, but too much fat is bad already. So something balanced diet. It has something to do with the diet. Vitamins will be fine. Sometimes we give eye-specific vitamins if we have mga age-related macular degeneration, which can help more specific sa mata yon. But it will not, taking these vitamins will not necessarily prevent you from getting ARMD, but it will help slow it down. So doon papasok yung mga ganitong klaseng vitamins.
Yeah, tama, Doc Norman. So there are only certain eye conditions that we ophthalmologists recommend taking lutein. So routinely, we don't advise you to take lutein because we can have those multivitamins and agree, Dr. Norman, na we can have it from our diet if we eat nutritious food, no? So we don't usually recommend taking lutein if you don't have, pag wala kayong sakit sa mata like yung macular degeneration na nabanggit ni Doc. No? So next question, Doc, can cataract occur in an earlier age, even before reaching the senior age of 60? No?
Yes.
So, yeah.
Actually, I'm a pediatric ophthalmologist, so I see baby cataracts as well. So if there's German measles during pregnancy, lalo na in the first trimester, then your baby might be born with a cataract already. Okay? May tinatawag na developmental cataract, then the cataract is formed. So you're born without a cataract, then slowly you develop some form of cataract. It's because of some genetic problem, like yung galactosemia. It's a genetic condition. It's a genetic problem wherein there's poor metabolism of their sugar, so nagka-develop din ng cataract yun. Many times idiopathic, so we don't know exactly what caused it, but you can really develop cataract even in younger age groups.
Okay. Yeah. So in relation to those eye conditions of pediatric patients, Doc, so why is it there are children even at a very young age, like toddlers daw po, na nagkakaroon ng mataas na astigmatism? Nako-correct pa po ba yun?
Okay. often we measure a significant amount of, as soon as we're born, we already have refractive errors. Okay, but there are acceptable refractive errors within that age group. So in babies, we measure high astigmatism as well. Still, that's still okay kasi it may go away later on. So during infancy, I don't give glasses if I measure a plus 500 na minus 500 na astigmatism or a plus 400 minus 200 astigmatism. I don't give glasses in babies. Pag ganun lang yung grado. Because the astigmatism will go away. Can go away pala. Okay? So we just need to follow up. So I start giving glasses about 2 or 3 years old if the grado is already significant to help in visual development. Because that's important. That's the main difference in adult eyes and children's eyes. Ang mata ng bata nagde-develop pa yung vision in the brain, not the eyes. So we need good visual input to stimulate development of the visual center in the brain. So if the grado is mataas, then I give it, even at a young age. But if the grado is mild lang, I don't necessarily give glasses at a young age. So going back to astigmatism, sorry. So it's okay to have that astigmatism, high astigmatism during infancy. But at later on, 2 or 3 years old, pag mataas pa rin, then sometimes I give na.
So that's why it's very important for the parents po to check kasi they won't know din po, Doc, di ba, at an early age kung may grado na yung mga anak nila. That's why it's very important pag may napansin po kayong symptoms o lumalapit sa TV yung nakikita. So, check niyo po kaagad kay Dr. Norman sa ating mga pediatric ophthalmologists. So, they can check po kung may mga grado na po yung mga anak po ninyo. So, in relation to that question, Doc, so there's another question. My child had an operation for strabismus, no, when she was 4 years old. So, lately, I observed that her eyes are not aligned again. So, does that mean she needs to undergo another operation? So, and will this affect her 3D vision if we can go for a consultation for her eyes?
Okay. So, when you have surgery for strabismus, it doesn't mean it's a cure for the strabismus because there's an inherent defect in the control of your eye muscles, eye muscle alignment. So, we improve the alignment through strabismus surgery, not necessarily cure it. When I say cure, I do something and the condition will not go back. Okay, so that's cure. But I do something, it's a treatment, but your alignment will improve in such a way na makaliit na lang yung misalignment, then your vision or stereo vision will develop as kahit paano normally or a significant amount. Okay, so that's the purpose of aligning the eyes as early as possible, so that the baby can develop stereo vision, stereo acuity. Okay? Not necessarily yung fine stereo acuity, kahit gross stereo acuity will be okay. Because if they get old and they were misaligned when they were young, they will not be able to appreciate the 3D movies. Okay? But if you're aligned earlier, then you will kahit paano ma-appreciate mo yung mga 3D movies when you watch it when you're an adult. The question is, we don't necessarily need to undergo the surgery again kung maliit lang yung strabismus, yung natitirang strabismus. Sometimes we advise exercises or glasses depending on the condition, but it may improve with exercises and glasses. Not necessarily surgery right away.
That's why it's very important po to have your child visit an ophthalmologist kasi it's very important to correct the problem at an earlier time, as what Dr. Norman mentioned po. No? So another question, Doc, is I am 23 years old with myopia grade 23, Doc, 525 and 450. So is there still a chance na bumaba ang grado ko? So in relation to that question, can the glasses cure the eye grade? Parang ganun.
The glasses will not cure the eye grade. Is there a chance na yung 525 at 24 years old or 25 years old
23 Doc,
will go down? It will not. It can have fluctuations. Short-term fluctuations will be okay. That's part of it. The only treatment there, if your eye grade is stable na, then you can have a Lasik done already. If your eye grade is stable. I think that's the only solution for you. The glasses will not bring it down, or is there a chance for that going down? Not anymore.
Yeah, yes. And then what are your thoughts, Doc, on washing the eyes after getting tired? Totoo ba yung pasma? I was, lagi akong tinatanong ng pasyente, Doc, pwede bang hugasan yung mata pag pagod na? Baka
Actually, pwede
mapasma.
naman. There's no pasma in the eyes. You can wash your eyes with cold water. You can sleep with your hair wet and not go blind, di ba?
Yes. Eh, mga common myths, Doc.
Kasi unang pagagalitan ka ng Mrs. mo or Mr.
Yan. Yes, yes, Doc. So, pwede po kayo maghilamos kung gusto nyo. Sometimes I ask the patients pa to put in the refrigerator yung eye drops nila, so when they apply malamig, it has a cooling effect. Then it adds to the relief that these eye drops do to your eye. No? So, question, Doc. Madaming questions, Doc. Baka hindi natin kaya lahat sagutin. Okay, so what again, we already answered it, the symptoms of cataracts, blurry, cloudy vision. How to avoid? Usually cataract po is age-related, no? So we can't really avoid, and we can eat no nutritious food and control our blood sugar. Because di ba, Doc, normal if we have high blood sugar, we can develop early cataract.
If
No?
you're diabetic, your cataract can progress. It's quite normal to develop some degree of cataract formation when you're old, 60. The question is, will this cataract be visually significant enough to affect your vision? That's the problem. But if it's not, then it's okay lang to have cataracts. Similar to the way I liken it, para sa skin natin, when we get older, we get more wrinkles because it's part of aging.
Aging, yeah. Or white hair, Doc. Diba? We can prevent our hair to
White hair.
Yes, yes. So next question, Doc. If you have glaucoma, can you also have macular degeneration? Also with retinal detachment, naku, ang dami na. So what measures to prevent? And is uveitis curable? And mas specific na sakit sa mata.
Okay. So, can ARMD occur with
Glaucoma,
Pwede.
retinal detachment.
Pwede. Lahat yung pwede mag-occur at the same time. It's possible but not usual. Can uveitis be cured? There are certain types of inflammation, uveitis, that's one time lang, then you're okay na. But there are uveitis na talagang chronic na hindi, you just want to control it. You want to control the disease. Even with glaucoma, the glaucoma doesn't get cured. Pag adult onset glaucoma, it doesn't get cured. You just need to control the disease so that it will not cause blindness or complications. Similar to diabetes, if you really have diabetes, it doesn't necessarily get cured. You have to control the disease so that it will not cause complications related to that disease.
Yeah. So, Doc Norma, in the interest of time, we cannot, that's our last question, so we can answer that. But there are lots of questions on the Q&A, so we'll ask Maxicare later on how can we answer these questions even after the webinar. No? So our attendees po are very active. No? They really want to know more about this topic. No? So thank you very much, Dr. Norman. So may I call back our host, lovely host, Patricia Hizon.
Oh, thank you so much, Dr. Charlene. And you're right, there are still so many questions, which is why I wanted to invite you first. Dr. Charlene, what your final message is for our attendees here before I go to Dr. Norman for his final message. Go ahead, Dr.
Yeah, so it's very important in this digital age, no? So it's very common to all age groups na po, hindi lang matatanda ngayon na nagda-dry eye, no? Because of our work from home, usually we do computer work a lot. So make sure, remember the 20-20 rule. So it's very easy. You will look something far at 20 feet every 20 minutes. So be conscious of, oh, tagal ko na nagko-computer, look na ako sa malayo. For just about 20 seconds, just to refocus your eyes, no? And then if you still have symptoms, you can easily go to us, your ophthalmologist, so we can check your eyes and prescribe the best artificial tears for you, no? And then make sure your proper posture, the distance from your laptop, and then your screen should not be eye level; it should be lower, like 4 to 5 inches lower, and the computer, the screen should be at least an arm's length away. So this will really help to lessen digital eye strain and neck or shoulder pain. So any problem, you can just consult with us.
Thank you so much. You know, a lot of people really believe that they have to put their monitors up higher, but those are really good. And I remember you telling me about the blinking part. So I'm more conscious now of how many times I have to blink within a minute.
Yeah, ma'am. So usually we should blink 15 blinks per minute, but when we do our computer work, we're concentrated. It goes down to about 3 blinks. So it will really dry up our eyes. So it's important to really rest.
So practical. Thank you so much, Dr. Charlene. And of course, we go back to Dr. Norman. Thank you so much for sharing this time with us and, of course, for patiently answering all of these questions. But you can understand now how people are really so interested and so invested in this. May I have your final message for our
So,
Maxicare members?
thank you for inviting us here. I hope I was able to help our viewers understand digital eye strain and help them manage it in their office work or school work. So, uh, my take home is listen to your body. So, your body is telling us if there's a problem. If you feel something, if you feel dryness, then or tired eyes, then your eyes are already tired. It's telling you to rest. So if you feel something in your eyes, it's there's a foreign body sensation or mahapdit na siya, then your eyes are dry. So you need to put the artificial tears and blink. Right? Beautiful eyes, ang sabi ko nga kanina. So thank you.
Thank you
Okay.
so much. Thank you so much, Dr. Fajardo.
Okay.
Thanks for reminding us to really care for our eyes. We appreciate your time once again. To our Maxicare members, can we please invite all of you to take a few moments to answer a feedback form? After this event, here is the link on the chat and the QR code on your screen. Of course, your feedback would be most appreciated. Don't forget to also check the chat as I mentioned earlier. And now, ladies and gentlemen, as we of course have shown our appreciation for both Dr. Norman and Dr. Charlene and have shared you also our feedback form links, it's now time to announce the winners of our raffle draw. Of course, the winners were randomly selected by our staff, and one winner will receive a laptop bag, another will receive a foldable umbrella, and another will get a mini clutch bag. So let's take a look at the names of those who Maxicare will get in touch with in claiming the prizes. Congratulations, Rose Ann, Retuya of Equicom Shared Services Incorporated, Vincent Belgira Medina, congratulations to you from Microsourcing, and from Aboitis Equity Ventures, congratulations to you, Zarina Gaa. So, like I mentioned, our Maxicare team will get in touch with you in claiming our prizes. Now, before you guys go, we still have two more quick poll questions to ask of you. And the first one always is, do you want to live your best life? And I think the answer is either yes or oh. Those are the two options. But of course, we all want to live our best life, which is why you took the time to attend this event today. And that's why we really appreciate you spending time with us this Friday afternoon. I know you guys are either working at home or just trying to get by today, but I'm glad that you guys are here. And 93% of you said yes, but 100% of us definitely want to live our best lives. Now, I want to ask which topics you'd like to see in our next Wellness Fridays because we have some of these options and you can choose more than one. Diabetes, diagnosis, treatment, and management of it, fighting TB in the time of COVID-19 pandemic, managing mental health, which is breast cancer awareness. So, what would you like to learn more about in our next Maxicare Wellness Fridays? A lot of us really want and are very interested in how we can better manage mental health. And the second top option there is diabetes, diagnosis, treatment, and management. We hear you, we see your opinion, and we will make sure that we will help you get through and be able to attend those events. Now, if you like this experience, please do share it on your social media using the hashtags Live Your Best Life and Maxicare Wellness Fridays. And please also tag Maxicare on Facebook at Maxicare Healthcare Corp and on IG at Maxicare Healthcare. Also, please take the time to take a look at and tag also the health and wellness IG at Maxicare Health and Wellness when sharing about this event. Don't forget to also subscribe to their YouTube channel. Please look for Maxicare Healthcare Corporation. Please also visit shop.maxicare.com.ph to learn more about Maxicare's other products. And you can send them a message also on their FB Messenger. If you have questions about this particular Maxicare Wellness Friday series, you may send an email to maxicarewebinar@maxicare.com.ph. So I guess I'll see you guys at our next Maxicare Wellness Fridays, which will be on August 20 at 5 p.m. This is where we get to talk about fighting TB and the COVID-19 pandemic. The QR code is being shared on your screens right now for the registration, so please make sure you register early. That ends our event for this evening. Thank you so much for being with us. We hope you enjoyed and you're able to take away meaningful information. I hope you guys can see clearly. Thanks again, everyone. Have a great evening and have a great weekend. We know that with Maxicare, you all can live your best.